The latest weather, traffic, and news updates online at 560theanswer.com. Now, from the Signature Bank Studios. If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Top of the morning, Dan Proft here. So on this government shutdown that did come to pass, as expected, because of the position that Chuck Schumer and Democrats took, and it was clear this was coming a couple weeks out. They want to spend another $1.5 trillion over the next 4 weeks and restore the spending that was resized by President Trump. Of course, that was never going to happen, including covering health care costs for people in this country illegally, which became a bit of a sticking point in the back and forth between, well, obviously the new Marxists and Republicans, but the new Marxist mouthpieces too, like Klingon Collins on CNN. She and Speaker Johnson had this exchange.
If that counterproposal was enacted, is illegal aliens would be paid for. American taxpayers, hard-earned dollars, would be paying for benefits for illegal aliens again. We're not doing that.
But it's against federal law for people who are here illegally to get
Yes,
health
and that's
care.
why our reforms are so important to enforce all that. What the important thing to remember is what's happening
I didn't see that the Democratic proposal that people who are here illegally should get health care.
No, because they don't have the level of specification that we had in our bill. It will unwind that, and all those things that the CBO just verified will be reversed. We can't afford to do that.
But you see my point, that there's nuance in the argument that you're making, right?
No, that is a red herring in this debate. What they've decided to do tonight with their vote is to close the government. And what that means, everybody needs to understand, real pain for real Americans. What does that mean? It means women, infants, and children do not get their nutrition programs. That is not funded anymore. Veterans don't get their health care services, suicide prevention, and other very important things that are very timely. You have low-income persons who are Medicaid, Medicare recipients who are receiving care at home. Those programs are now lapsed. They will not be funded.
Yeah, you're making a point about what happens if the government shuts
That's
down.
right, and they just decided to do it. So the only question tonight is, how long will Chuck Schumer keep the government closed? It's a dangerous gambit. It's something that he himself said his entire political career would be dangerous and disastrous. Roll the tape. We're rolling the greatest hits on our social media.
Yeah, I'm just saying.
And Mad Maxine Waters, No Justice, No Peace Maxine, who Mike Johnson references having sort of inadvertently admitted that is the new Marxist Party's position, is they want spending to cover health care for all in this country, including those here illegally. Well, yeah, that is sort of what she said.
But aren't Democrats demanding health care for illegal aliens?
Democrats are demanding health care for everybody. We want to save lives. We want to make sure that health care is available to those who would die, but having the help of their government.
Mm-hmm. Everybody would include the, I don't know how many ever tens of millions of people who are in this country illegally, by definition, wouldn't it? There was a follow-up to get clarity from No Justice, No Peace Maxine, which is not an easy task. And then she sort of figured out that maybe she doesn't want to be so forthright about the party's actual position. And so she can't say no. She doesn't want to say yes. So you just attack the question.
So you're good with the government shutdown, even if it means giving health care to people who aren't American citizens?
Well, that's what you're pushing on. What you're trying to do is you're standing here and you're trying to make me say that somehow we're going to put non-citizens over Americans. Quit it. Stop it. This is the kind of journalism we don't need.
No, I'm just
you're
asking
divisive.
questions.
No, you're not. You're being divisive. No, please. You don't need to ask that question.
No.
You're just trying to get controversy here. You're not going to get it from me.
No, boy, you played that well. Representative Waters. Woo, you played that well. No, we're not going to put non-citizens over citizens. You're trying to get me to say that. I'm not going to say that. But we will treat non-citizens like citizens and just cover everybody. For more on this, pleased to be joined by C. Stephen Tucker, the principal of healthinsurancementors.com. CS, thanks for joining us. Appreciate it.
Good morning, Dan.
So this is, the argument that you've heard yesterday was it was all about sort of Obamacare subsidies to ensure access to quality care for Americans. This is what Democrats are saying the shutdown is about, but it's about much more than that in terms of what their demands are, their spending demands. But just on that narrow issue, can you address that?
Yeah, so the narrative is that Democrats want to fund Obamacare subsidies for illegal immigrants. That has never been allowed. It is not allowed today. It was not allowed since 2010. They're specifically barred from obtaining federal health insurance subsidies and always have been. In the GOP's tax law that they passed under President Trump, they stopped subsidies to go to those who are lawfully present immigrants, such as refugees, asylum seekers, and people who have visas, for example, people who are legally present here but are not American citizens. That is what they want to restore. Democrats, that is, not to illegal immigrants. They've been barred from getting federal subsidies since the inception of the law. Now, that is a very small minority compared to the number of American citizens who are going to lose federal health insurance subsidies on January 1 of 2026, unless something is done. And I suspect something will be done. I suspect they will spend $1 trillion. They will solve this government shutdown rather quickly because the market's going to bear the pain of this shutdown starting today. I suspect a 200 or more point drop in the Dow. So it's going to be resolved quickly. But what is the argument really about? The argument is really about the American Rescue Plan and the Inflation Reduction Act, two pieces of legislation that were signed by Joseph R. Biden. During the nightmare that was COVID, when they were shutting down everything that was non-essential except, of course, the essential places like stripper places and marijuana.
Yes, of course. Yes.
And Home Depot. Those are essential.
Yes.
The rest of us, of course, couldn't work, couldn't leave our houses because of the tyranny of those that imposed those ridiculous acts under COVID. But nevertheless, during then, because we couldn't work and we were non-essential, they enhanced the federal subsidies for Obamacare plans from 400% of the federal poverty level to over 625% of the federal poverty level. And so in plain English, that means a couple before the American Rescue Plan in 2021, if they earn more than $78,960 a year, they qualify for no advance premium tax credit, aka no federal health insurance subsidy. That same couple, if they're in their 50s, for example, can today earn more than $200,000 a year and qualify for large advance premium tax credits. Because they did that under the American Rescue Plan in 2021, which was sunset to end in 12 months. But then along comes the American Rescue Plan, or the Inflation Reduction Act, which extended the American Rescue Plan subsidies all the way to January 1, 2026, and then sunsetted them. They come to a screeching halt on January 1. Which means that couple who is now enjoying a federal health insurance subsidy making over $200,000 a year is now going to lose all subsidies if they're making more than $80,000 a year.
Well, this is the other aspect I wanted to get to too. So I want to go back to the to that cohort of people who are not citizens and may be here illegally. But let's start with the other cohort here that you're describing. And this is the point that Republicans are making too, is basically the Medicaid or the Obamacare expansion that provides Medicaid coverage and subsidies for people that were never intended to be covered by these programs. It makes these programs even more unfinanceable than they already are. So, I mean, isn't there this issue of going back to what Maxine Waters said, which is the actual position? We want a government, we want single payer. We want government to cover health care for everybody in the country who's here, legal or illegally. They don't really, philosophically, they don't really want to make a distinction. But the point is to say that there is no interest in auditing the Medicaid rolls, federal, state, joint programs. There's no interest in trying to remove anybody from the rolls, even if they are ineligible or it was never conceived that they would be eligible under Medicaid.
Correct. It is only due to Dr. Oz, who's now sitting at CMS, that we have now been able to identify millions and millions of people who are receiving federal health insurance subsidies unbeknownst to them because they were also enrolled in Medicaid.
Right.
And when you're enrolled in Medicaid, you can't get an advanced premium tax credit. And yet these unscrupulous brokers all over the country, all they needed was a name and a social security number, and they could enroll them without their consent.
Well,
and get a large commission.
And so I don't want to interrupt, but I mean, this is my point going back to, technically subsidies, if you're in this country legally, you're not eligible for them. But I mean, the position of the new Marxist Party is no oversight, no guardrails, and no accounting. So you can say under the law, this is not allowed to happen, just like under the law, these people shouldn't be getting something that they're getting or shouldn't be on the rolls that they're on. But in terms of practice, when there are no accountability mechanisms and no desire for said, then of course it opens the door. And I think that's what Mike Johnson was getting to.
Yeah, I mean, the law is very, very clear. Illegal immigrants cannot get federal health insurance subsidies. They never have been able to. They can't do it on Medicaid either. They're not eligible for Medicare either. The evidence that is true is that J.B. Pritzker created brand new programs, state-based only, which were allowed to provide Medicaid, which was much better coverage than Illinois residents could get, to illegal immigrants. Yeah. He had to create and fund a program entirely separate from Obamacare. If illegal aliens could get federal health insurance subsidies, he would have just sent them to healthcare.gov, but they can't, right?
Yeah, right.
And they never have been able to. So the argument is not about illegal immigrants. It is about those who are lawfully present here that cannot get federal health insurance subsidies. They want that to continue, the Democrat Party. That said, that is an infinitesimally small number of people compared to the 4 million American citizens who are going to lose their health insurance subsidies and probably not be able to afford health insurance as of January 1 if they don't extend the subsidies set to sunset under Biden's American Rescue Plan as of January 1. And I suspect they will extend them for a year or two.
I want to get your reaction to something else, the Trump RX pharmacy that was announced yesterday with Pfizer CEO Alberto Boller in tow. This is what Trump had to say.
Many years, Americans have paid the highest prices anywhere in the world for prescription drugs. They paid far more, 10 times, 13 times, 15 times more than other countries for the exact same product. A major reason is that the American consumers have been subsidizing research and development costs for the entire planet. They put all of that on us, and yet they were the beneficiaries too. So it's being changed as of today. The United States at just 4% of the world's population and consumers, only 13% of all prescription drugs, yet pharmaceutical companies make 75% of their profits from the United States. So think of that. We have 4% of the market. 13% of prescription drugs, and yet, Albert, I didn't know you were that violent. I'm surprised you're here to do this.
I'm getting better.
No, he's doing the right thing. Thank you. And yet they make 75% of their profits from the American customers, so it's something. That's why I signed an executive order combating this practice, and we signed it very happily.
Yeah, well, I'm not a big Alberto Bourla fan or Pfizer fan or Big Pharma fan. And so here's the deal. Trump RX, direct-to-consumer website for discounted drug purchases with Pfizer offering some drugs. Pfizer offer all of its drugs to Medicaid at a reduced most favored nation price and introduce new drugs at reduced prices. In exchange, Pfizer receives a 3-year exemption from national security tariffs if it invests in domestic manufacturing. What say you to this gambit, CS?
Well, it's interesting to see how well the pharmaceutical companies did on Wall Street yesterday after this meeting. And that, of course, is because all they have to do in order to get America to be the most favored nation status is raise prices in other countries, right? Mm-hmm. So that it looks better here, right? Now, they are going to develop this website, which is trumprx.gov. If you go there today, it doesn't work because they're building it so that it will be revealed next year, probably around June. And they're going to sell their products, Pfizer, et cetera, direct to the consumer. There are two problems with that. One is a benefit. It eliminates the high cost of PBMs, pharmacy benefit managers, who take a lot of money in between the manufacturer of the drug and the end user, the consumer. But if you buy through direct websites like that, your insurance is not going to cover it. And so who are they really appealing to? Well, there are currently about 27 million Americans who are uninsured, which coincidentally is the same number we had before Obamacare. But nevertheless,
of course,
it's not going to help those people who have insurance because they're not going to cover it, right? But if they're smart, what they will do, and if I was advising them, what they would do is they would take all the copay cards. What people don't understand is in this country, for many years, the evil pharmaceutical companies have been giving away their drugs to people like me and many others. All they have to do is go to the manufacturer's website, apply for the copay card. You don't have to be poor. You just have to have private health insurance. Yours truly takes a drug called Dupixent, which stops my sinus polyps from regrowing. I no longer have to have surgeries. That drug costs $4,000 a month. I pay nothing for it because I applied for the copay card through the manufacturer of Dupixent. They go through my Blue Cross insurance, and I pay a zero copay. That happens all over the country so long as you are insured. And again, you don't have to be poor. So if the Trump administration was smart, they would take all of those websites where the consumer has to go search and find these copay cards and put them in together at TrumpRx.gov so that those who are uninsured and those who are insured can take advantage of these unique benefits provided by pharmaceutical companies. That is how I would advise them.
Oh, that's interesting. Yeah, that sounds like a sage advice, which is why you're on the program. It's something, though, that, I mean, so I bristle at price controls because I'm a free market kind of guy. And this sort of mercantilism, these sort of like doing deals with Pfizer, government and Pfizer in bed together. You genuflect before the government, you get a special carve out. I don't like it. But also underlying the philosophy here, I think, is a misunderstanding of the environment. So that there was a 2024 RAND report that found name brand drugs in the U.S. were 422% of prices in comparison countries.
Yes.
That's what he was referring to. However, unbranded generics, which make up 90% of all prescriptions dispensed in the U.S., were on average cheaper at 67% of prices in comparison countries, where on average only 41% of prescription volume is for unbranded generics. So you have that top line, oh, big pharma's ripping, but then you have the unbranded generics, which actually are most of the overwhelming majority of the prescriptions, and it's a very different story. That's number one. Number two, yes, we essentially subsidize the R&D so they can reduce prices to overseas markets, talking about the pharma companies, but we have an access advantage for doing that. And there are access issues in other countries to these drugs that will be visited upon us if we impose these price controls writ large. That's the concern.
Well said. Well said. That's why you're the host of Chicago's Morning Answer.
No, thank you very much.
I couldn't add to that. I do want to close with this. In a week from now, every Illinois resident who has Obamacare in the individual marketplace is going to receive a love letter from healthcare.gov. Our dear leader, J.B. Pritzker, has removed 450,000 people who get individual health insurance from healthcare.gov. You may no longer use healthcare.gov in the state of Illinois, nor can you use Health Sherpa. You must use J.B. Pritzker's new site, getcovered.illinois.gov. And he has assured all Illinois residents it's going to work perfectly, just like healthcare.gov worked perfectly in 2014.
Oh, yeah.
I am so convinced that it's not going to work. Well,
what's the basis of this change?
They want to work specifically through an Illinois state exchange. We have been a state-federal partnership exchange since 2014. They are now detaching themselves in every way possible from the evil Trump administration.
Yeah, of course.
And so now, so we're now going to be our own state-based exchange. So everybody's going to get a letter. You all have to go to getcovered.illinois.gov as of October 6th and claim your account, right? And I'm sure it's all going to work perfectly, which is why I will be off the air from October 1st until February 1st, because I'm convinced that I'm going to be navigating hundreds of people through this process, and it's not going to go smoothly.
The C.S. Tucker full employment plan there. You're going to send a love letter to J.B. Pritzker, I presume.
Right. Exactly.
C.S. Tucker, C. Stephen Tucker, always value-added information from C.S. Tucker. HealthInsuranceMentors.com. Those love letters are coming. You may want to contact C.S. at HealthInsuranceMentors.com for some navigation assistance. C.S., thank you as always. Appreciate it.
Thank you, Dave.
And C. Stephen Tucker joined us on the Turnkey.pro answer line.
The stories you need to know to start your day. This is Chicago's Morning Answer on AM 560. The Answer.
Salem News Channel is America's fastest growing conservative TV network.
It's an absolute crazy day.
Home